The Department of Health or DOH confirmed that polio has re-emerged in the Philippines, 19 years after the country was declared polio-free by the World Health Organization or WHO. Children in the Philippines are at risk of lifelong paralysis because of this polio outbreak. Reports from the DOH indicate that the number of polio cases is rising. The DOH and partners are working together on a comprehensive outbreak response, including mass polio immunization rounds since October 2019. All children, regardless of whether they are covered by the mass immunization campaign or not, should be vaccinated according to the routine immunization schedule. The Global Polio Eradication Initiative or GPEI, which supports the Philippine government's response against polio, has 5 partners, namely the WHO, Rotary International, the U.S. Centers for Disease Control and Prevention, the United Nations Children's Fund, and the Bill and Melinda Gates Foundation. Locally, the Philippine Red Cross actively collaborates with the DOH and other local government units to end polio. Polio is a contagious viral illness that in its most severe form causes nerve injury, leading to paralysis, difficulty breathing, and worse, death. Although it can cause these complications, the majority of people who are infected with the virus do not get sick and are not aware that they are infected. Poliovirus can be transmitted through direct contact with someone infected with the virus, or less commonly, through contaminated food and water. People carrying the poliovirus can spread the virus in their feces. Those who have the virus but do not have symptoms can still pass the virus to others. Polio mainly affects children younger than 5. However, anyone who has not been vaccinated is at risk of developing the disease. The most effective way to prevent polio is vaccination. The first of 3 rounds of scheduled mass vaccination campaigns has been successfully implemented in polio-affected areas. From October 14 to 27, a total of 1,628,717 children under 5 were vaccinated, out of the targeted 1,703,639 in the National Capital Region or NCR, Davao del Sur, Davao City, and Lanao del Sur. Both NCR and Davao City have reported reaching the 95% vaccination target. All children in the Philippines will be vaccinated until January 2020. However, more rounds may be needed depending on the incidence and prevalence of polio. Vaccines are provided by the DOH through the various local government units. The devolved healthcare setup in the Philippines, however, leaves low-income local government units with less resources for health. International organizations such as UNICEF provides additional vaccines in the country. Primary care providers such as nurses, midwives, doctors, and other public health workers administer the vaccines to children. The eradication of polio is included in the National Immunization Program of the DOH. As a program, case management approach ensures that cases of polio are managed and resolved. The oral polio vaccine or OPV is given 2 drops per dose to a child. Meanwhile, the inactivated polio vaccine, or IPV, is injected. OPV is given when a child reaches the recommended age of 6 weeks. The succeeding 2 doses are given in intervals of 1 month. On the other hand, the single dose of IPV is given together with the 3rd dose of OPV. In cases of outbreaks, what are the ethical issues related to vaccinations? The first issue is respect for persons. Does vaccination respect persons' rights? Decision about polio vaccine usually falls onto parents. Do parents always end up promoting the best interest of their children? What happens if they are ignorant or misinformed? Here, the relevant concept is autonomy. Is autonomy best conceived in terms of respecting the personal decisions, irrespective of their belief that they are misinformed? Is autonomy also conceived through the persistent effort to inform them of scientific evidence that shows the benefit of vaccination? The second issue is beneficence. Do the benefits of vaccination outweigh its risks? We may consider that the benefit of vaccination becomes possible by exposing people to some risks. How many people died from vaccination? How many people died or suffered from incurring polio? People who die from vaccines are arguably less. The third issue is justice. Is it fair to those involved? People who refuse vaccine also pose risks for the health of the community in relation to being able to prevent the spread of the disease. This relates to the concept of herd immunity. If about 95% of the population are vaccinated from a disease, then it will be enough to shield and protect those who do not have immunity and leave the virus to die or become eradicated. If more people refuse vaccination, then herd immunity will not work. The disease might spread and even evolve to become more potent. It seems that refusal for vaccination can only work if these people are few. If they reach a critical percentage of the population, they would render the whole community vulnerable to the disease. In this case, vaccination becomes a kind of personal responsibility that leads to some kind of social justice. One must cooperate with others in the community to prevent the disease. Likewise, refusal for vaccination can be associated with a certain kind of disrespect for those who try to prevent the disease. Their efforts and health interests are treated with injustice, such that they become mere means to an end. This brings us to conflicting ethical principles in the issues of vaccination. The idea of promoting public health comes with the worry that it can violate individual rights. People's right to be vaccinated comes with the principle of autonomy. Individuals have the right to decide for themselves. What is good for the individual may not be good for the community. In refusing vaccination, the individual threatens the health of the greater community by undermining herd immunity. If we consider the greater community, vaccination may be required for everybody. But is mandatory vaccination ethical? Proponents of mandatory vaccination believe that these procedures are necessary for maintaining public health. Their opponents argue that they infringe on the rights of individuals. Their conflict reflects the tension of the two ethical principles, the principle of respect for persons, and the principle of beneficence. A way of reconciling these two principles is through education and health information. These can eradicate misconceptions and false information about vaccination. So what can we do to end polio? Local governments should intensify the implementation of the Zero Open Defecation program and to strengthen the call for environmental sanitation and personal hygiene. Stakeholders must mobilize their respective communities and participate in immunization activities. Parents and caregivers are advised that the best protection for their children is vaccination. Family members must be reminded about simple interventions like washing their hands regularly with soap and water, using proper toilet facilities, cooking food thoroughly, and drinking safe water. Surveillance activities must be enhanced through active case finding of acute flaccid paralysis and other symptoms of polio. All children should be vaccinated according to the routine immunization schedule.